So, good morning, student. How are you all?
Hope you all are good. So today we start antihypertensive drugs and vasodilators.
Now, what is the antihypertensive drugs? You have any idea? Okay. Antihypertensive drugs are those drugs who improve the arterial pressure in the blood. That's called when the arterial blood pressure is uh, disturbed. That time we should prescribe the anti uh, hypertensive drugs. Okay, so before start this topic, first we clear what is hypertension. Okay, it is defined as physiological condition where these is increase the arterial blood pressure above the normal. The normal blood pressure is 120 by 80 mm of Hg. An individual is hypertensive when BP is greater than 140 by 90 mm of Hg. This is, you can see one image, one diagram, blood pressure in the wall measure of the force apply wall of the artery. Okay. Next is introductions. First, these drugs used to lower BP in hypertension, and hypertension is a very common disorder, particularly past middle age. It is not a disease itself, but it is an important risk factor of cardiovascular mortality and morbidity. Okay. And the hypertensive is elevated of systolic and diastolic BP above 140 by 90. It is common the cardiovascular entry. Hypertensive may be primary essential hypertensive when its cause uh, is unknown. Okay, there are mild hypertension, moderate, severe hypertension, we can say. Okay, next introductions above. This is hypertension, and this is hypertension systolic BP. This is systolic BP, and this is diastolic BP. Okay, and when the diastolic BP is less than 90, okay, greater than 90, and systolic BP is greater than 140, the time we can say ki this patient is having now hypertension. Okay, next one is hypertension is defined as either as sustained systolic blood pressure of greater than 140. Already we discussed it is greater than 140. We told ki this is the diastolic, increase the diastolic blood pressure. Okay, next it reduce high blood pressure is called when the agent that reduce the high blood pressure, it's called antihypertensive drugs. Okay, peripheral and systolic between 120 by 139 mm of Hg and diastolic between 80 to 89 mm of Hg. First effect of hypertension. First is increased risk of heart rate and heart failure, kidney diseases, blindness and stroke. Okay, primarily hypertension, it the unknown reason, the reason is not known. Okay, secondary is hypertension due to some causes such as kidney diseases, abnormality and adrenal gland will be non-pharmacological method first. Okay, next is classifications. Okay, classifications first, we can say we will see the diuretics. First diuretic is thiazide. Okay, thyroid's types. First is hydrochlorothiazide and chlorothiazidone. Next is bendroflumethiazide, and next one is trichloromethaziide. Okay, it's all are the diuretics. Diuretics work is increase the urine output. When the increase urine output, the time BP is down. Okay, when you give the Lasix to the 2 ampoule or 4 ampoule Lasix to the patient, for example, you should give patient 1 year 2 ampoule 4 ampoule to the patient directly IV. The time when patient BP is greater than 200, okay, the time the BP decreased, okay, the BP is decreased and down. It's after giving the Lasix, this BP is decreased, okay, the time the BP is like 160 and 140 like that, okay. It is the work of diuretics. Next one is potassium aspirin. Okay, aspirin, this is spironolactone, first drug, and miloride and trimetrin. Its three drugs is potassium aspirin. It is also work to reduce the BP. And next one is loop diuretics. Loop diuretics, I will already I give to you example for Lasix. That Lasix name is furosemide. Okay, yeah, ethacrenic acid, yeah, bumetanide, yeah, torsemide. Okay, this all are the loop diuretics. Next one is ACE inhibitors. ACE inhibitors first captopril, enalapril, lisinopril, peridronapril, and ramipril. All are the ACE inhibitors. Okay, whenever we give this all ACE inhibitor to the patient, it's improved the hypertensive condition. Okay, next one is angiotensin, yeah, antagonist. First one is lesartan, irbesartan, and kendrastin. These all are the antagonists. Okay, next classification continue is sympathetically. First one is centrally acting drugs. Okay, this drugs is used to also improve the condition of hypertension. Okay, first is clonidine and methyl-dopa. Next one is ganglionic blockers. That's name is trimethophan. Next one is adrenergic neuron blockers. Its first drug is risperidone and guanethardine. Next one is beta adrenergic blocker या फिर beta blockers, that is propranolol, metoprolol, atenolol. Okay, next one is alpha and beta adrenergic blockers या फिर alpha beta blockers. Its example for betaterol and carbidoderol. Okay, next one is alpha adrenergic blockers, parajosin and trijosin, phenethylamine. Okay, next one is classification continue, calcium channel blockers. Calcium channel blockers, verapamil, deltazim, nifedipine, felodipine, amlodipine, and lesidipine. Okay, next one is vasodilators. Vasodilators, first one is hydralazine, next one is minoxidil, sodium and nitroproside. Next one is diuretics. It enhances the excretion of sodium and water, resulting in decrease in plasma volume, decrease cardiac output, and decrease BP. When the plasma level is decreased, the time cardiac output also decrease and decrease the BP level. Okay, next body sodium relaxation of vascular smooth muscles increase the BP. Next, thiazide are the first line antihypertensive and they are expensive. It combined with potassium sparing diuretics is the best way to avoid hypokalemia. Okay, next one is loop diuretics. It is a powerful diuretics. Their antihypertensive effect is low. It is used only in hypertension with chronic renal failure of congestive heart failure. Loop diuretics is powerful diuretics. Their antihypertensive effect is low. It is used only in hypertension with chronic renal failure or congestive cardiac failure. Next is antagonists. angiotensin converting enzyme. Okay, angiotensin converting enzyme inhibitors. First one is angiotensin. Second is powerful vasoconstrictor. It is helpful to vasoconstriction of the muscles, and adrenosterone also rise the BP by increasing the blood pressure and plasma volume. Okay, next one is this is all anti-angiotensin converting enzyme prevent the formation of angiotensin, and secondly indirectly aldosterone there is vasodilators and its decrease in peripheral vascular resistance resulting in further BP. Next one is angiotensin. How we will know when we give angiotensin, the time renin is increased and angiotensin first angiotensin converting enzyme is activated, and angiotensin second is do vasoconstriction of the muscles, after that increase the BP, and there when we will give angiotensin third, the time aldosterone is activated and it's salt and water retention, after that blood volume is increase. Okay, next pharmacokinetics. Okay, pharmacokinetics. ACE inhibitor well absorb except capryl and lisinopril. It's angiotensin converting enzyme inhibitors are excreted through the kidney. It's mostly excrete through the kidney and out through the urine. Next is persist dry cough due to increased bradykinin level is more common in a woman. Next one is hypertension, headache, apnea. This all is the sign and symptoms. Okay, nausea, adverse effect. Okay, abdominal pain, adverse effect of the angiotensin drugs. Okay, hypertension, headache, ache, nausea, vomiting, abdomen pain, hypokalemia. Okay, proteinuria, neutropenia. Okay, dysphagia and altered taste sensation is more common in a captopril. Next one is angioneurotic anemia. Okay, ACE inhibitors, angiotensin converting enzyme inhibitors rarely larynx and airway obstruction. It is with angioedema with swelling the lips, nose, larynx and airway, totally airway obstruct. Next one is skin races, reddish coloration of the skin, races, and next one we can see, we will see hypertension. First use of these drugs is when hypertension, the BP of the patient is rise 140 above, 160 above, greater than 160, the time we should use the drugs in as called hypertension drugs. Okay, next congestive heart failure. When the patient have congestive heart disease, congestive heart failure, the time we should give these drugs. Next is myocardial infection. When patient have any infection to the myocardial layer of the heart, the time we should give the patient these drugs. Next is coronary artery disease. When the patient have any disease in the coronary artery, the time we should give the prescribe this antihypertensive medications to the patient. Next one is chronic renal failure. Whenever patient have kidney are not working, totally fail the renal, the time we should give the patients antihypertensive drugs like diuretics. Okay, this is renal crisis. Next one, whenever patient have renal crisis, that time we should also give these drugs. Next one is precaution and contraindications. When we take the precautions, and whenever these drugs we should not give to the patients. Okay, first is age inhibitors are contraindicated in the pregnancy. Whenever patient have any pregnancy, when women have any pregnancy, conceiving time, that time we should not give these drugs to the patient without consultations to the doctor. Okay, next one, it should not be combined with case parang diuretics. Okay, next one is at the first sign of angioedema, angiotensin converting enzyme should be stopped. Whenever first sign, when you see any sign, any contraindications, any adverse effect in the woman, patient, that time you suddenly stop these drugs. Next one is ACE inhibitors may enhance to plasma level of the receptors. Okay, next is angiotensin second receptors blockers. First is Lizartane was the first orally effective and angiotensin first receptor antagonist. And these all are the receptors. These are two subtypes of angiotensin second receptors and angiotensin first receptors. Angiotensin receptors present in vascular and myocardial tissue, brain, kidney, and adrenal glomerular cells. Lizartane has high affinity and angiotensin first receptor when the combined angiotensin second receptor, it is blockers angiotensin first receptor. Lizartane block the effect of angiotensin second receptors. Okay, next one is diuretics. Diuretics have been the standard antihypertensive drugs over the past 4 decades to the do not low BP is normotensin. Okay, understood? Next is thiazide, hydrochlorothiazide and chlorothiazidone. These are the diuretics drug of choice of uncomplicated hypertension. When the hypertension is uncomplicated, that time have the similar efficacy and or the dose is equivalent. Thiazide, we should provide the patient hydrochlorothiazide and chlorothiazidone. Okay, next is high saline diuretics. High saline diuretics, it is normally we use in clinical areas like fusamides. Fusamides local name is Lasix. Lasix, the prototype of this class is a strong diuretics, but the antihypertensive efficacy does not fail diuretics potential, and fusamide is weaker antihypertensive than the thiazide. Okay, understood? Next one is indapamide. Okay, it is a mild diuretics chemically related to chlorothiazidone, reduce the BP at dose which cause little diuretics. Electrolyte disturbance and potassium loss are minimal and antihypertensive doses. It probably has additionally vasodilator action and excreted through alteration of ionic fluids across vascular smooth muscle cell. Indapamide also give whenever patient have antihypertension, severe hypertension, the BP is greater than 160. The time we should provide the patients indapamide to improve the blood pressure level. Next is angiotensin converting enzyme, ACE. Angiotensin converting enzymes inhibitors. Angiotensin converting enzyme inhibitors, first choice of drugs in all the grades of essential as well as renovascular hypertension except those which bilateral renal artery stenosis. Okay, whenever patient have any renal disease, renal artery stenosis, the time we should provide the patients ACE, angiotensin converting enzyme. Next is nursing implications या role of nurse, या we can say कि whenever patient in clinic area at the time, how to implications of what are the role nurse for these drugs. Okay, first nursing implications is risk of fall in evidence as vasodilators can cause postural hypertension, so the patients must be graded while getting up. Okay, got it. Next is palpitation can be due to reflex tachycardia induced by the vasodilators. Sometimes patients have tachycardia and steady palpitations of the veins, that time induced by the vasodilators. Okay, next, sodium nitroglycerides act when it is the second. Okay, next is BP monitoring. Strictly monitor the BP to the patients. Okay, it should be dissolved in 2 ml of 5% dextrose solution and then diluted in IV fluid. Next implications, nursing implications, it is the light sensitive and protective from light by a opaque wrapping. If the color changes, effusion should be discarded. Effusion is prolonged blood level, CN and thiocyanate should be checked. Okay, next is it should not be prolonged for more than 2-3 days. Whenever you put any infusion pump, you should NTG pump, infusion pump में you should put 2 ampule of NTG drugs last 2 weeks. That is wrong. Whenever you put NTG to the in the syringe, 50 ml syringe, give through the infusion pump, it is changes every 2 days. Okay, and it should not be prolonged. Any antihypertensive drugs, when we should give through the NTG infusion pump, that time you should change this alternate day. Okay, this is end of this topic. If you have any doubt, you ask me. Okay, and vasodilator continue tomorrow class, right?